Good morning and welcome to the Tuesday, May 13, 2025 regularly scheduled meeting of the House Committee on Finance. The committee will come to order. Clerk Campbell Crawley, please call attendance.
Chair Tisdale.
Here.
Representatives Frisbie.
Here.
Vanderwall.
Present.
Leitner.
Here.
Martin.
Here.
Posthumous.
Here.
Alexander.
Here.
Aragona.
Here.
Schutte.
Here.
Hoskins.
Here.
Carter.
Here.
Neely.
Here.
Breen. Young.
Here.
Pies.
Present.
Mr. Chair, you have 15 members present. You do have a quorum.
Thank you very much. Vice Chair Frisbie makes a motion to adopt the minutes for the May 6th meeting. Being no objections, that will be adopted with unanimous consent. We'll start off with a vote. House Bill 4387, that's the homeowner out-of-pocket disaster indemnification bill. Need a motion to move that forward. Vice Chair Frisbie makes that motion. Madam Clerk, please call the roll.
On the motion to report with recommendation as substitute H1, Chair Tisdale.
Yes.
Representatives Frisbie.
Yes.
Vanderwall.
Yes.
Leitner.
Pass.
Martin.
Yes.
Posthumous.
Yes.
Alexander.
Yes.
Aragona.
Yes.
Schutte.
Yes.
Hoskins.
Yes.
Carter.
Yes.
Neely.
Yes.
Breen.
Aye.
Young.
Yes.
Pies.
Yes.
Mr. Chair, you have 14 yeas, 0 nay, 1 pass. The motion prevails.
And 4387 moves forward with recommendation. Testimony, House Bill 4202. Representative Johnsen.
Thank you, Mr. Chair and members of the committee. Good to be with you on this beautiful May 13th. House Bill 4202 is a straightforward pro-family proposal that updates Michigan's tax code to reflect the real documented financial responsibilities that begin during pregnancy. The bill allows a taxpayer to claim one additional personal exemption if they are at least 10 weeks pregnant as of December 31st of the tax year and have been under the care of a licensed physician since that point. This change would take effect beginning in tax year 2026. Our current law allows a full year exemption for a child born by December 31st, as well as for a stillbirth when properly documented. That's appropriate, but it leaves a gap. A pregnant woman who has carried a child for most of the year, attended prenatal visits, borne significant physical, emotional, and financial responsibilities, receives no recognition in our tax code unless the child is born by year end. House Bill 4202 addresses that disparity and brings parity to how growing families are treated under state law. The 10-week threshold is intentional. It is medically meaningful. At that stage, the fetus has a detectable heartbeat, organ systems are forming, and prenatal care is typically underway. This ensures the exemption is tied to objective, verifiable facts. It also provides administrative clarity. A signed statement from a physician confirming gestational age and care as of December 31st would be required to qualify. No self-reporting or ambiguity. Importantly, this bill is designed to complement, not replace, existing support programs. The federal WIC program that we are all familiar with, for example, begins providing nutritional assistance as soon as pregnancy is confirmed. And WIC is based on financial lack, financial means. That's the test there for a WIC qualification. This would be different as it would apply to anyone in the tax code. As long as they have income, they get the exemption. House Bill 4202 adds to that support by providing tax relief at a later, more clearly defined stage of pregnancy when financial burdens tend to increase. Together, these policies reinforce one another and reflect a consistent commitment to supporting expectant mothers in a practical, responsible way. This bill does not create a new entitlement. It does not expand government bureaucracy. And it does not affect Michigan's legal definitions related to personhood or abortion. It simply applies the same logic and fairness we already use for children born or lost late in the year to a pregnancy that is ongoing under medical care. This is a modest but meaningful bill that gives expecting mothers an added measure of support without creating a new program or imposing additional burdens on the state. It's pro-family, fiscally responsible, and grounded in medical reality. Thank you for your time and consideration, and I welcome any questions.
Do we have any questions? Vice Chair Hoskins.
All right, thank you, Mr. Chair, and thank you, Representative. Just a quick question: how would this impact families who choose to go the route of surrogacy?
Well, that's a really good question. Any child tax exemption would apply to having a child. Legally, when they take over the pregnancy or the rights of as parents, would be when the tax code would start. I would assume.
Yeah, it just in the as we introduced and passed legislation around surrogacy last term, it looks like in this legislation, the exemption applies to the person who's pregnant. But typically in surrogacy agreements, is the parents, the intended parents, they're the ones who take care of those costs. And so I'm just trying to make sure that the people who are actually bearing the costs for all those things are the ones who actually will get the tax benefit.
You know, we need to look into that because it's for the mother carrying and incurring the costs. It's to try to help women with the financial burdens. I don't see any reason why they wouldn't, but I'll get back with you on that.
Okay, that's fine. And Mr. Chair, I have one more question too.
Sure.
Why an exemption a tax exemption as opposed to a tax credit?
Another excellent question. The exemption applies to more. What we're encouraging is birth rate. We're encouraging they are working, they're receiving an income, and they get the exemption from the income. The tax credit is more like WIC. It's dependent on you have a lack, you don't have the financial means, and we're trying to incentivize hard work, but then you get some relief here through the exemption and an accountability piece there with being employed.
Yeah, and I think one of my concerns is just that sometimes with the exemptions, the people who really need it, the people who may not be able to, lower income, people who have lower incomes, they might not be able to take advantage of an exemption as opposed to a tax credit.
Absolutely. And that's why we have the welfare system, Medicaid, WIC programs for those who already they need assistance right from the get-go. And those are still in place. This doesn't take away from any of that.
Okay, thank you.
You're welcome. Representative Leitner.
Thank you, Mr. Chair, and thank you, Gina, for bringing this legislation forward. And I know you referenced the 10 weeks as viability for this legislation, but what if, and this is a what if, they went to the doctor at 9 weeks, right? Or even 8 weeks. They were late, finally found out, and then they decide they don't want this baby. But the end of the tax year is right there. Like, are they still eligible for an exemption even if in the 11th week they do an abortion?
It's what they verify at the 10 weeks and what the physician signs.
Okay.
Yeah, this really is not, this is not foolproof for even the stillborn baby gets the child tax exemption, or the parents do for a stillborn baby. So it doesn't rule that out.
Is there any flexibility in the number of weeks for this exemption? Just out of curiosity. 10
weeks or longer. They have to
But
be at
it's
least
the
10 weeks
minimum.
along.
That's what I'm saying is
Right.
like, is there any, I'm just thinking like a lot of them are like, okay, first trimester, 12 weeks or whatever, rather than 10.
Well, you
Just
know, we
curious-
started out
just
with
curious.
8, and some people wanted 10. I just was congenial to the conversation, and I said, if that's what's going to be agreeable, then we'll go with 10 weeks. You know, some people know at 8 weeks that they're pregnant, 9 weeks. Some people know before that, just they know. Pregnancy tests certainly can detect it before that. But 10 weeks was a compromise, and it's certainly where a lot of women find out certainly that they're pregnant, and they're able to get a doctor's appointment. Some of them can't get it till 11, 12, 14
Sure.
weeks also.
Okay, thank you.
Representative Young.
Thank you, Mr. Chair. And thank you, Representative, for coming before us on today. A quick question for you, because I understand that it has to be certified by a physician. So as a mom who had both of her sons, her only 2 sons, with the nurse midwife, I'm wondering, is there an opportunity for nurse midwives to be able to certify that a mom is expected?
I started out with that conversation because there's a number of pregnancy clinics, midwives. There's alternatives to actual
Birth
DO
Detroit
or
right
MD.
now, yeah.
Right, and this is what the other folks at the table preferred. But I'm with you. If we put it back to that language, I'm good with that too. And we can. That's what committee's for, right? We have the discussion and we refine it. And I like the way you're thinking there.
All right. Mr. Chair, just one other question. I was wondering, I didn't hear you mention anything about cost. Have you had any conversations with the Department of Treasury regarding this?
They are giving us a report back
Okay, we don't have it yet.
shortly.
House fiscal maybe?
Yeah.
Okay.
But keep in mind, I do want us to keep in mind, when you give tax exemptions to a situation that promotes more folks being around to pay taxes and more purchasing going on, when you have more children, you purchase more things as parents. You circulate more into the economy, and the tax base actually can go up in the end. So what looks like a deficit might actually be a net credit in the end, because you're having a higher birth rate. All across the world, not just the U.S., the conversations are going on to increase birth rate and to have more people. Our greatest resource is human resources. And so it would just stay in line with that and increase the overall economy. But it's a good question. Yeah, good math, thanks.
Yeah, throughout the advanced economic world, birth rates are down.
Yes.
In many countries, not replacement rates. Relative to Representative Leitner's question, I'm just thinking out loud here. The way the bill reads, if you're verified or certified 10 weeks pregnant within that calendar year, prior to that tax year ending, you would get the exemption.
That's right.
If the pregnancy is lost or terminated in the next year, obviously the exemption is not going to occur at the end of that calendar year. That would be my presumption.
Yes, you are correct. And it will go that direction, or in 1 year, let's say year 1, you get a tax exemption for the pregnancy. In year 2, you get a tax credit for the child.
Sure.
And it should continue on from there.
No child, no exemption.
No child, no exemption, no pregnancy, no exemption. Unfortunately, there's situations where some children don't live to 10 years old, but that doesn't mean you don't get the first 9 years plus pregnancy exemptions either.
Yeah. Meanwhile, the mother's incurred expenses.
Exactly.
And it'd be a difficult way to game the system, but who knows?
We're trying to build
You
in
know?
accountability
Right.
here, and some eyes on it, and not just self-reporting and saying whatever, and yet give some relief to women that definitely incur, and families that incur the financial
Okay.
difficulties.
Anything else? We have some amendments to offer. The first is from Representative Young. Would you like to talk about that, please, or reiterate?
It's what I talked about, including the nurse midwives. Because they play an important role in the birth story.
I'm good with that.
Lift that.
You turn your mic on. your microphone on?
Can't hear you.
Okay. Nurse midwives, adding them to this. We want to uplift those types of birthing stories. So, thank you for that.
Pardon me? Okay. Any other comments on that, anything? All right, I want to call the roll on that, please.
Okay, on the motion to amend, Chair Tisdale,
Pass.
Representatives Frisbie,
Pass.
Vanderwall,
Pass.
Leitner,
Pass.
Martin,
Pass.
Posthumous,
Pass.
Alexander,
Pass.
Aragona,
Pass.
Shooty,
Pass.
Hoskins,
Yes.
Carter,
Pass.
Neely,
Take that back. I'll be a yes.
Yes.
I was in consultation.
Neely, Breen,
Aye.
Young, and Pies. Mr. Chair, you have 6 yea, 0 nay, 9 pass. The motion does not prevail.
Okay, and that motion does not prevail, and consultation sometimes can be painful. Representative Carter, would you like to talk about your amendment, please?
Thank you, Mr. Chair. It just refers to the Pregnant Women Who Can't Afford Prenatal Care Act.
Okay. Clerk, will you please call the vote?
On the motion to amend, Chair Tisdale,
No.
Representatives Frisbie,
No.
Vanderwall,
No.
Leitner,
No.
Martin,
No.
Posthumous,
No.
Alexander,
No.
Aragona,
No.
Shooty,
No.
Hoskins,
Yes.
Carter,
Yes.
Neely,
Yes.
Breen,
Aye.
Young,
Yes.
Pies.
Yes.
Mr. Chair, you have 6 yea, 9 nay, 0 pass. The motion does not prevail.
That motion does not pass. One more amendment. Representative Breen, would you like to speak to yours?
Thank you, Mr. Chair, and thank you to the sponsor for recognizing the need for additional supports for pregnant women and working moms. And I do have some reservations on this bill, but I can say that my amendment would go a long way to getting me to a yes. This amendment would tie bar your bill to the very popular Momnibus package, which is addressed towards black and brown women and infants who are 3 times more likely to die from pregnancy and birth-related causes. This package, working in conjunction with your bill, could be a real lifesaver. It will improve outcomes. It will do things like require Medicaid coverage for off-site or remote ultrasounds or for fetal non-stress tests, which is something needed for women in remote areas or unable to access health care. There's a lot of good that could come from the Momnibus package, and that's why I've asked for this amendment to tie bar your bill to it. Thank you.
All right. Thank you, Representative Breen. Clerk, please call the vote on that.
On the motion to amend, Chair Tisdale,
No.
Representatives Frisbie,
No.
Vanderwall,
No.
Leitner,
No.
Martin,
No.
Posthumous,
No.
Alexander,
No.
Aragona,
No.
Shooty,
No.
Hoskins,
Yes.
Carter,
Yes.
Neely,
Yes.
Breen,
Aye.
Young,
Yes.
Pies.
Yes.
Mr. Chair, you have 6 yea, 9 nay, 0 pass. The motion does not prevail.
All right. Thank you very much. I have one card to read in on 4202. In support, wishing not to speak, Rebecca Masty, Michigan Catholic Conference. Testimony, House Bills 4375 and 76, Representatives Frisbie and Snyder. Good morning, gentlemen, and begin when you're ready.
Good morning. Thank you, Chair Tisdale and committee members. One of my goals, and many of yours, is to make Michigan more affordable for our citizens. Over 30 states right now have the same legislation we're offering today, or mirrors of it. The bills that we're proposing are straightforward and eliminates a double taxation effect. And that would allow people to more readily afford today's electronics, which are becoming more and more important in today's world of school, work, and other things that are going on. So it's very straightforward. It will protect lower incomes from double taxation, and we think this makes a lot of sense for all involved.
Thank you, Chair Tisdale and committee members for allowing me and Vice Chair Frisbie the opportunity to testify on this package this morning. Put simply, these two bills would deduct the value of the trade-in before sales and use taxes are collected on personal electronic devices. Deducting the trade-in value from the taxable amount reduces the overall sales tax burden on consumers. This can make purchasing a new portable electronics more affordable, especially for students and low-income families. Lower-income buyers who rely on trade-ins to afford new electronics benefit significantly from this deduction, promoting fairness in our tax system. For example, if I were to buy a $1,000 or new phone valued at $1,000 and the trade-in my old phone for $250, under current law, I'd pay sales taxes on all $1,000 of that purchase, not just the $750 after the trade-in cost. These bills would bring us in line with over 30 other states to provide some financial relief to hardworking Michiganders. To me, these bills are simply about consumer protection and preventing double taxation. And with that, I think we can answer any questions.
And there is precedence for this type of tax management in the state with automobiles.
That is correct.
So just kind of mirroring or mimicking that
Yeah.
sales credit process.
Yes.
Yeah, okay.
Sales tax on the difference.
Representative Breen?
I have a weird question. Who's determining the trade-in value, and is that going to vary, like, in different areas across the state? Just, if I've got I'm going to say, I don't know, my dad's Discman, which probably has no value left at all right now, but you go somewhere, you've got a Discman, you got an iPad, and you take it
Henry
to...
Ford Museum might want
we did see one there. It was right next to the cassette tape thing that we used to have. So I'm just wondering if, is there a particular company that has sort of a monopoly on determining what the trade-in value is, or does that vary depending on where you live?
So each manufacturer retailer is the one setting that value. It also promotes recycling. So we're keeping these out of landfills. They're able to pull them apart, take out the important components that can be recycled, and put them back into the marketplace in new devices. So
Trying to pull at our environmental heartstrings out there? I mean, you're winning,
Whatever
so
works,
good job.
whatever works. I would just say the retailer as well, and then I'd say there might be some additional testimony from some stakeholders in the audience that could expound upon that.
Thank you.
No other question? You have others to testify with you? Or do we have?
we do.
We do have
Representative Young?
I was just wondering, piggybacking on my colleague here, but is there a age limit? So just how far back are we going with these devices? It makes sense, all the everything and all of those things, right? iPads and this and that. But are we going back to the day of the Walkman?
Well, I think that's retail dependent and what they want and what they're willing to pay money for or value to. I just turned in a phone. I upgraded my phone in January, and I have another really nice phone I'm going to keep as a backup. But I had a really, really old phone available. It was a flip phone that I found in a drawer. I turned it in. They gave me the full value for it. So it's all retail dependent and what they want to put the value on, but it shouldn't be taxed again.
I would just say it's fair market value for whatever they're able to get for those devices.
Thank you, gentlemen.
Okay. Thank you. And we had others to speak on this issue? Come on forward. Hi. Turn on the microphone there and you can begin when you're ready. Please introduce yourself.
Thank you, Mr. Chair and members of the committee. Thank you for your time this morning. My name is Olivia Spears, and I'm a government affairs attorney at Assurion. In case you're not familiar with us, Assurion is the world's largest tech services company. We're most known for our work repairing and replacing smartphones and other handheld devices, but we have also expanded our business into repairing, replacing, and installing all consumer electronic devices. We also own the U-Break iFix stores that you may have seen across the state. While we're based in Tennessee, our footprint extends well into this great state of Michigan. We have 90 employees here, approximately 2.3 million subscribers, and 18 retail stores. I'm here before you today to testify in support of House Bill 4375 and House Bill 4376. This bill is simple and straightforward. It would allow Michigan consumers to pay sales tax on the difference between a new portable electronic device and the agreed upon value of a traded in portable electronic device. Right now, Michigan is one of the few states whose tax law does not contemplate the value of a trade-in for the calculation of sales tax. Thus, consumers are paying a double tax on the same device, first when it's purchased and again when it is traded in for a new device. This bill saves consumers money on devices that are essential to daily life, eliminates a regressive tax burden, and thus benefits lower-income consumers, protects consumers and businesses from double taxation on electronic devices, incentivizes further trade-in of electronics, which encourages retail spending and prevents products ending up in landfills, and encourages business and spending within Michigan instead of going to neighboring or nearby states to save on that sales tax. As I mentioned earlier, Asurion owns several stores in this state, and this change would allow us to harmonize our operations across the country and scale up potential device sales to consumers in the future while also making them more affordable for the consumer. In summary, this bill is good for Michigan consumers, business, and the environment. We would appreciate your support. Thank you for your time today. I stand ready for questions.
Any questions? Seeing none, thank you very much.
Thank you. Appreciate it.
There are no absent members to excuse, but there are cards to read in for House Bills 4375 and 76. Wishing not to speak but in support, Gavin Getz, AT&T of Michigan. Wishing not to speak but in support, Lauren Neal, T-Mobile. Opposed to the bill but wishing not to speak, and has submitted written testimony, Brenda Pilgrim, MASB, and wishing not to speak, opposed, Matt Schuler, Michigan Association of Superintendents and Administrators. And now, there are still no absent members to excuse. No other business in front of this committee. Meeting adjourned.